Welcome to the Nourish
Thank you.
Together Gut, Heart, and Mind podcast. Thank you so much, Dr. Jordana Quinn, for being here today. Quinn, I said queen because you are a
It's
queen.
okay. I didn't mind it.
So, Dr. Jordana is a doctor of osteopathy, and she stands at the forefront of holistic health and wellness, embodying a unique convergence of expertise in physical medicine and rehabilitation, regenerative medicine, anti aging medicine, and psychedelic medicine. As a board certified physician, she champions a philosophy that individuals harbor an intrinsic ability for healing, and she's devoted to nurturing and awakening this principle in her patients. Thank you again for being here, and I'm so
Yeah,
excited
thanks for
for our
having me.
conversation.
Yes, likewise.
So, Dr. Jordana, I'm wondering if you could just tell us a little bit about your own history and story around coming into osteopathy and then regenerative medicine, anti-aging, and then the psychedelic piece.
Yeah, I'll try to keep it somewhat concise, which I think I can do. I've talked about it so much, but I'm very traditional trained osteopath and physician. And so I started off in a very just regular Western medical pain management, sports medicine practice. And I didn't love it. And I would say like it was the majority is pain management, but there's some sports medicine. But if I could, over stereotype and say the difference I see in pain management versus sports medicine is there's often the same conditions. It's just the mindset of the people walking in as a whole, pain management mindset is very much like what can you do to fix me? I need a pill. I need a thing. I'm going to blame my life of why I'm in pain. And the sports medicine mindset, because the injuries are very similar, not the same, is what can I do to overcome my injury? And so that was, or what can I do to, give me a physical therapist or give me a thing where I can take my health into my own hands. And so that was like very early on, a very clear, and again, that's not everybody, but that was just a very clear distinguishment and like the mindset of people walking in, not the actual disease. So I didn't love my job. I at the time also worked with a lot of addicts, and I just felt like in that whole realm of what I was doing in medicine, I was begging people to take care of themselves essentially, and for fun, kind of reading books on nutrition and books on like healthy lifestyle, which at some point when I'm just reading nerd books for fun, I'm like, I should do this like for a living. And it's always been my personality to be more holistically minded. So even like in medical school, when we would have to give lectures about cardiology or pulmonology or whatever system we were learning, I would always give the alternative medicine lecture on it. And so it's just always been within me. And feel free to interject at any time, but I feel like this is kind of like my story. So
Yeah, no, I'm loving listening. Thank you.
I've also always been an athlete. So I believe as athletes, many of us at least are a little bit more in tune with our body. Like we recognize, you're training for sports. And so you exercise really hard. I mean, I was a competitive athlete growing up, so I would train for things. And you also realize just, what you're fueling your body with as you get closer to competition matters. And kind of, we have a general sense of that. So I feel like that's within me. So in residency, I had learned about platelet-rich plasma injections and stem cell procedures, which are under the guise of regenerative medicine. So we learned about them in residency. We didn't do them at the hospital that I worked at, but I was aware that these procedures existed, and I researched them, and I thought it was the coolest thing. Like, to me, it just makes sense to use your body's own natural healing ability to heal itself. And so if we can harness that, amazing. And so I already knew about it. So when I was my first few years out in practice, I had a couple professional athletes that like couldn't do things in traditional medicine, like steroid injections for their pain, because you can't be on steroids. And so when I was researching these alternative therapies, I found a clinic close by that did the injections, and I would send the patients there. And so after sending patients, so I actually remember there was one patient who had a completely different terrible disease, and she was looking for alternative treatment to just like pain medications. She didn't want to take opiates, and she had tried everything. She had tried everything. And so I looked up again another like alternative treatment for her pain, and found the same doctor who I had been referring to regenerative medicine procedures for. And so I thought, again, like I'm reading nutrition books, like that's so cool. This doctor does high dose IV magnesium for pain. That's amazing that we can use something naturally. And so I basically wrote this doctor a letter and asked him to hire me. And, while that didn't happen so easily, it did happen over time. Kind of, I worked for him for free for a year. Like one day a week, I went and I shadowed him in his office and I just watched what he did with patients. And he mentored me. And a year later, he hired me. So it was a long process of commitment. And this physician was an anti-aging medicine doc. And I had no idea what that was at the time. And what anti-aging medicine is really, is one of the earliest forms of functional medicine. It's really helping to prevent disease and optimize your health so that you can live a high quality of life for a long time. And taking it one step further, there are also anti-aging techniques that actually prolong life. And that is a very new field of medicine that has not been around for a long time. And so is continuing to evolve. So it's taking kind of functional medicine, lifestyle medicine, like really looking at what you're doing in your life to better your health. And then you can add things on like supplements, you can add some medications, you can add techniques that are truly slowly reversing time in your body. And so that's anti-aging medicine. So when I was practicing with him, I literally because he hired me to do the regenerative medicine stuff, which I had known about, I was like mind blown. I was like, I could do this in medicine. And honestly, I just felt like home. To me, I call it common sense medicine, or I call functional medicine common sense medicine. Even though in Western medicine, we need titles and we need studies to prove that lettuce is good for you more than Doritos or something. I don't know, but to me, it's common sense. And I think that speaks again to just being an athlete and having a little bit of understanding of my body. And so anyhow, I was immediately at home in this practice. I worked with him for years. He continued to be a mentor, learned not everything, but as much as I could, and I still can learn anti-aging medicine. I go to a ton of conferences to keep up with the information because in the field of regenerative medicine and anti-aging medicine, and I've been doing this for 14 years now, so it's still new baby in the medical world. I was one of the first regenerative medicine physicians in the stem cell space at all. And so I've been doing it for a long time, but the information is still ever evolving, right? In regenerative medicine and in the anti-aging world, especially, there's very new research on supplements or medications or things like that that can kind of reverse the clock of time. So that's how I ended up there. And then, and so, in these fields of medicine that I practice and have practiced and continue to practice, really my goal is optimal health, however you want to view it. So I see a lot of patients who are already very healthy and literally come to me for what can I do to slow, the hands of time. And then I see, the gamut of patients who have, let's say, disease or pain and, want to be better. So it's different levels of better, right? I think everybody says they want to optimize their health in their life, but it takes work. No matter where you are, whether you already have disease or you're preventing disease, your health is definitely, you have to want to be an active participant of your health. It's not passive. And so there's so many things you can do. So it just depends on what you want to do, right? And so I try to meet people where they're at, but my goal is to really help people optimize their health, help people believe and see that the power of healing is within them. And sometimes it does require medication. To be clear, I'm not anti-Western medicine. I just think there are some steps in between here and meds or here and surgery that we should and could be taking before we jump to these other things.
That's huge. And I just want to not rephrase it, but actually just focus on what you just said, which is all the steps we can do between where we are and the more drastic, say, surgery or medication. And that sometimes those are warranted, but that there's so much we can do because it's what we do every day that counts the most.
It's what we do every day. I put it into context of, and there's so many different, pillars of health or aspects of health, optimizing sleep and stress levels and mood, and your relationships are important and your community is important in your health. And then obviously exercise and diet. And so all these things are important. And I say this because, I view it as, I think people can understand compounding interest in finances, right? If you put $1 in and you're making 5% on the dollar, you're going to make 5 cents. And if you put $100 in, you're going to make $5. Right. And so the more things you put in your bucket of health, the more output you actually receive. And so it's kind of like compounding interest of health, right? You need, you need everything, and you get to put more sleep in or more stress in or less stress, or, whatever it is you want, you get to make your like high however you want to. But it's just realizing that it all really does impact your baseline levels of health and is important. And we don't have it all the time, right? But it's all is important, and knowing that it's there and accessible is important. And so kind of jumping into how psychedelics got added on. So I've worked in this world forever, and then 5 years ago, I think like the long and short of it is I had a psychedelic change my life, and I was totally not prepared for that, to be honest. I was a medicine man was coming to where I live, and I heard great things about him, and my husband had already tried, and he was like, you should try this thing. It's lasts 15 or 30 minutes. In my mind, I was like, okay, I could do anything for 15 or 30 minutes. Why not? And I didn't research it, but I did spend a lot of time setting an intention, like months meditating and really thinking about it, going into it. And then I tried this psychedelic, and it changed my life. And I can go into the ways it changed my life, but let me finish but one of the ways, and actually the smaller way it changed my life, is now I do this in my practice. And so it might seem like it's the bigger way, but truly, like, energetically and emotionally and like vibrationally, I was a completely different human afterwards. Um, and and so one of the ways it changed my life was it told me like that I needed to add this to my practice. And I fought with that for a year because I was like, I'm a doctor, I don't do psychedelics, I didn't want to add ketamine. I used to work with addicts also in my early days of a practice, and people get addicted to ketamine, and ketamine was legal for physicians to do. So I fought with it, but it was like the day I knew, or the medicine told me that I had to do it, it was ingrained in me. Like the day I knew I was going to be a doctor at 14, and never looked back. Like it would not leave my body. I didn't question it in terms of like it was in me. It wasn't thought that, but I fought with it because I was like, that's not what I do, that's not what I'm trained in, all this stuff. And then it took me a year, and finally, like a year later, I added it to my practice. And honestly, like the rest is history. I mean, it's been an evolution, it's been life-changing for people. I can talk a lot about like this side of things in a minute, or we can talk about other things, but it's even when I question doing it, because I think there's such a big responsibility that comes with doing psychedelics. I know this is like the right path for me. And the reason it fits into my practice is, again, going back to kind of a few different things I touched on, is mindset matters in your health. Like the way you view your health matters. And if you can't get over trauma that exists in your body from your mind, and it's a very real thing, it's in your body, but if you can't deal with it, if you don't know you have it, if you haven't faced some of your own personal truths, you will never get to the goals you want with your health. Like there will be a block, and you might definitely move in the right direction, right? But your brain,
it's not a complete
controls
process.
So many things. And so I couldn't let it be, because I really, even though knew the mind body connection, when you see it on that realm, like you can't unsee it.
Right. Wow, thank you. So I just when I reflect back, because it is such a beautiful journey, and I love that you said that at 14 you knew you wanted to be a doctor. Do you remember what that moment was like, or what kind of inspired it?
I do. I think like my parents were watching PBS or something, and there was a surgery on TV, and it was actually an eye surgery. And I was just like in my mind, it was like, I want to do that, even though I like no interest in eye surgery. That was never on the table for me. But it was just like that in terms of like healing people and helping people. And it was literally like that feeling, or at least that's my memory of it. Like it was an eye surgery. I was like, whoa, but like I want to help people in that way, like in the holistic way. And it like, never changed. And I didn't like narrow in. I went through stages of wanting to do pediatrics and sports medicine and like everything. So the path to get there was always not direct, but I knew like I just, ever since that moment in time, I was like, I can help people in that way. And I was like, I love biology, I love puzzles. I think I've always been like a healer, people person, like had that like I'm a people person. So it was like putting together all those puzzles, that was like immediately like everything I like to do into one, or
Yeah,
thought I would
and
like
as
to
an
do.
athlete, it makes sense that osteopathy and the sports medicine was kind of your gateway into it.
Yeah.
What kind of athlete were you? Like, what kind of sports did you practice?
So I was a competitive gymnast growing up, and then in college transitioned to like springboard diving. So those were my main like two competitive sports. I quit in college, and then was no longer like a college diver, but just, I continue to, now I mountain bike and do yoga and lift weights. I mean, now I do whatever people want to do, but regularly I do yoga and lift weights, and mountain bike are kind of my main sports.
Wonderful. Okay. And
Yeah.
so from that moment of discovery, it sounds like it was both intellectually and then at the heart level where you're like, that's what I want to do. And it stayed with you. From then the moment with your psychedelic journey when you saw something that felt, from what I heard also from speaking to you before, that it was beyond this like recognition in your mind and in your heart, that it was a part of you that like knew in a different way that that's what you needed to do with integrating psychedelics into your practice. Can you talk a little bit more about that moment and what it was like to like see that?
Um, so that moment did not come to me during the journey. That moment was the evolution. There was a lot to process after the journey. And so it was like a couple weeks of like sitting on my couch when I typically might like meditate or be silent in the morning and just really thinking about the journey and processing it and taking my time with it. And so I don't know if it was like such a clear moment of this is what I have to do, but I mean, like it was and it wasn't, but it is something like when it's in your body, it's really just hard to describe of it's just there and it's there. And like, I mean, literally I was like, no, like trying to like make it go away of like, I'm not doing this. This is stupid. Like literally like trying to clear it, but it wouldn't go away. I mean, it just was like, it was not a thought at all. It was just like a feeling.
And how did you get then from that feeling to actually implementing it in your practice? Was there any particular training that you did? And, and
Um,
how was that received? This being not a new modality, but it's new in the sense that it's just now becoming more recognized and accessible.
yeah, I think I did take some courses. Ketamine therapy from a pain perspective is in my training as a physical medicine and rehab doc. So I was familiar with the med. So it wasn't like coming from nowhere. Um, but the training I did was like, a psychedelic approach, which, like, so I had the medical training. I'm familiar with this medicine. I still took another training in it. I have educational FOMO. So I took a couple different trainings. But I was familiar with how to use the medicine. And then I did a few more journeys on my own with different medicines because I do very much think that it's important as practitioners that we have a lot of experience in the spiritual and mystical realm to be able to do this work because a lot of serious stuff can happen in on these medicines, and serious being like people aren't going to die, but mentally, spiritually, emotionally, like it's big. Um, Honestly, I didn't say anything. And the day I internally decided, or the month, I internally decided that, okay, I'm going to move forward with this. How am I going to move forward with this? Within that month, 3 different patients asked me if I did that therapy. So my answer was yes. So I didn't
Wow.
advertise. They were just like, do you do this? And so the answer was yes, because, I felt that that was the universe like saying, now it's time. And it just kind of has evolved from there, to be honest. And since then, I've taken other courses, I mean, on different therapies. And I mean, I'm in a few different psychedelic communities that are very big, and you get a lot of support. You learn a lot of things. I go to lectures. I mean, again, I have educational FOMO. Um, I can't say I study with, but I hang out and learn from the indigenous cultures a lot in the community. I think that's important. Um, and so it's never ending. I mean, I'm just early. I've been doing it for 4.5 years, but I would still say I'm very early in the evolution of, where I'm going with it in my practice.
So what have been some big aha moments as far as a practitioner, as far as the healing that you see that is possible or that becomes possible through these
I mean,
journeys?
I think to explain it, like the big aha moment for me is realizing, I mean, the potential power. So just way back then, but even like if I can articulate it, the power lies in like moving and seeing your fears right in front of you, whatever that is. So, and facing them and moving through them. So, and I'll explain it a little bit more, but as opposed to very much in our culture, we don't like to be uncomfortable. So we take meds or not, right? If we are depressed, we take an antidepressant. If we have anxiety, we take, and again, an anti-anxiety med. I think these medications all serve a purpose. It's just like, what work have we done to get to the place we may or may not need these medications. And so, um, so a lot of Western medicine serves to suppress, or at least in this realm, our emotions, or like you're too hyper, or you're too this, or you're too that. And I get it. We live in a society, right? I mean, if your kid has ADHD and they're going to school and they truly have ADHD and you're trying to put them in a classroom and sit at a desk all day, which I don't think anybody should be doing anyhow, but like sit at a desk all day and just focus on me at my time. Like we need to live in a society to do things, but when you try to put billions of people into one bucket of the way we do things, it doesn't work. And therefore potentially we medicate so they could fit into our what we call normal. Okay, so I mean, I'm like really trying to put words onto this, a much bigger thing, but so there's no time to feel. I mean, I hear all the time like I'm overly emotional. There's no such thing. You're just emotional. Like you just have emotions. Humans have emotions, and we've been trained, especially as physicians, and I see, because I do facilitate journeys for a lot of physicians, um, and other um, people in the medical realm. A lot of people who go into medicine of any sort, physicians, chiropractors, naturopaths, nurses, come from a trauma history. It's very interesting. I didn't know that. And and we've learned to suppress. So we want to help people. We love helping people. And separately, we have been trained to suppress our emotions, right? Because nobody wants me crying when I'm in the operating room or being like, and then this happened. And that would not be the appropriate place. Like truly, like I don't think all of it's appropriate all the time, but we're so trained in that. And so many humans, like we just don't feel. We just go through life like reacting and not feeling like into our body. And so like some of this, when I say like I felt it in my body, it's hard to explain, but it's true. And when you can tap into that, like your body knows. I mean, your body knows what is right. And so the aha moment to understand like these medicines, I mean, is, so let's say you have childhood trauma, right? Let's say whatever, you were abused by one of your parents. That's in your body somewhere. And I see this all the time. Plenty of people will have physical pain or not be sleeping or be overweight, and they don't ever relate it to the trauma they had when they were a kid. And when you can do some of these medicines and see that trauma happening, so it's facing it, it's like going in and digging up the trauma, which sounds terrifying, and it is, you literally can move beyond. Like you have to feel to heal, and you have to go through the process of feeling. And so many people are afraid of feeling, and including myself. When I do journeys, sometimes I get really like afraid going in because you don't know what's going to come up. But it's really your only fear is of feeling when you think about it. But we get so uncomfortable feeling sad or feeling angry or speaking our truths or whatever that is. And so it is uncomfortable, to be clear. Like these journeys are not fun, but they are truly healing because you feel the emotions. You're in a different realm. So it's not even feeling sad or angry like we would in this realm, but you're able to see, or sometimes just have compassion for your perpetrator or for yourself and how you treated someone else or for whatever. And so you literally feel, you move through, and that pain could be gone like this. I mean, that is how it is, literally overnight or within hours healed or gone away. Or and sometimes it takes a few sessions, but it's just like those, like, so realizing that you got to feel to move through and heal is, and seeing it happen is just like, oh, like I get it. But we don't want to. I mean, partially because of our culture, partially because we're human, it is uncomfortable. But as we know, I mean, in sports, you work your butt off, you train your butt off, you're uncomfortable running so fast, your lungs hurt, your legs hurt. Like that's how you evolve and get better. And it's the same with your emotions. And so that's kind of like medically the aha moment for me. And then I've seen it. I've had suicidal people in my office that within a few sessions, I mean, I've heard them say, quote unquote, I can see how mean I'm being to myself. Whereas before they couldn't, right? Because we're just in our mind. I can see how mean I'm treating myself. I can see, I'm trying to think, like I've had addicts in here where they've been addicted to, I mean, opiates or alcohol or other things for years, I mean, decades, and they do a few sessions and I mean, they're crying, like it's, again, they're not like dancing and partying, like it is like, and they're like, I see how crappy I've treated myself, like by putting that into my body, or I see that I was trying to escape. I see that I'm the same as everybody else, right? Because so many addicts feel like they're alone and they're the only ones that feel that way. I see how mean I've treated other people, and like I want to do better. And people have reached out to like long lost friends and written them notes, and honestly, sometimes it's well received and sometimes it's not. But it's just like it's moving beyond the mental stories that we make up. I don't know.
I love that you say seeing some, because I do feel like, especially from my limited knowledge of psychedelics, but as it has always been used in traditional cultures, in indigenous cultures, it really was this aspect of seeing, kind of seeing beyond sight, but seeing through inner
Feeling. Yeah.
knowing, through the whole body, through the heart, through the plant world, through like you just get to a place of seeing in a different way. And what an
Yeah.
amazing like awareness that brings, like you said, everything
It's
from
amazing.
addiction to pain, it can completely change. That's
Yeah.
wonderful.
And yeah, I mean, it's beautiful. It's like work that I feel so compelled to do and help people through. And again, it's not easy. And that's when when you're taking in these big, like spiritual journeys, because it's not just like a thing, it's a big, people are like, oh, I'm just going to hold space as if they're just going to be present and that's good enough. And it's so much more than just like your presence. And your presence is important. Um, but it's holding space is like really holding the safe container of everything that makes up this person and beyond. It's interesting.
And it sounds like it awakens a sense of possibility that for a lot of people sometimes isn't there. Is that right?
Yeah, yeah, yeah. I mean, yeah, it's yeah, it's so different than anything I've in medicine. I don't know, it's so hard to describe.
And what would you say is your biggest challenge right now, whether it's, legal landscape or just people's fears? I don't know, like is there something that keeps coming up for you
Like with psychedelics or in
with the
all,
psychedelics specifically? Yeah.
I mean, my biggest challenge personally is the struggle with not culturally appropriating indigenous culture, but honoring the ceremony of the space and honoring these medicines and the seriousness and the spirituality of it, and knowing that I have to do this work, but I don't want to step on people's toes or, and I know there's always going to be people who disagree or agree with what you do, but just really taking this spirituality and, in indigenous cultures, I mean, it's not just like, oh, I learned this. Like, you don't just learn it because you take a course and you decide you're going to do it. I mean, it's learned by sitting with the land and listening to the land and then listening to your elders and their education around their ceremony is more than like an online education or something. And you don't just get when you're like initiated into being able to serve medicine. It's not like, yeah, you just completed a degree, here's a certificate. It's like you have done the land justice and you are giving and you have sat with the medicine enough and the elder has watched you and listened to you or feels you and knows you. And so it's so much different than our very Western education. And so my struggle is to make sure I'm doing it justice for my patients, making sure I'm really holding space in a safe way. And, that I'm always practicing like at my highest self. And it will be an evolution and knowing that like where I am today is not where I will be in 5 years, but, I have to do what I can with the information that I have and know that I'm, really not harming people. And harming people is such a big word because there could be like the obvious things you shouldn't do, but you could harm people by not knowing what you don't know. Um, and so I don't know, that's just the struggle for me is a lot of the psychedelic forums I'm in and groups I go to are honoring people of color in this space and honoring the indigenous space and not just being like a white person who's like, I'm gonna do it my way and it doesn't matter what came before, as if I'm the first person to carry this knowledge of medicine, right? When people have been doing it for thousands of years and that those cultures and those lineages have so much knowledge, but you have to give it time to just sit and be with it and listen. You can't just intellectualize your way through.
Yeah, and I really appreciate that about you actually, because even as you talked about your year of mentorship with the doctor you wanted to work with,
Yeah,
this commitment to going and learning and sitting with and having a proper initiation, like it isn't just about taking a course with all of the healing modalities. I couldn't agree
yeah,
more that there's so much we need to really learn in different levels of our being in order to actually be able to be a tool for healing for others. And I
Agreed.
really get that with you, how you've sat and you've mentored and you've, paid attention, and it's so honoring of those who came before you.
Yeah. Thank you.
Um, yeah, well, thank you so much. How can people get in touch with you? Like, is there any group or any way that people say all around the country or the world for that matter can connect with you and learn from you?
Um, so we have, I don't personally have like a podcast or anything like that. I'm Core Medicine. Core is Kore Medicine on kind of all of the Instagram. On LinkedIn, it's Core Dash Medicine, and then Facebook is Core Medicine. You know, to like make an appointment at my office, it's coremedicine.com. And I do see people from all over the world. Some people fly out to do stem cells with me. We have, I mean, like programs like lifestyle programs that we put people on, or for lack of a better term, optimal performance programs that, people are on, where we work on kind of any aspect you need to work on. We don't have like a skeleton that one size fits all approach. So we take your needs into account. We host retreats, and so I give you that information, but the retreat is activevoyageretreat.com. The retreats
Yeah, and
are
I'll
very
have the links too.
okay. Yeah, and the retreats are like 4 days, typically geared towards people who want physical and mental, because we incorporate psychedelics and yoga and movement and meditation. As typically I've found it's either one or the other. So the athlete in me wants to like move my body and get the wiggles out and eat healthy and organically, and then the spiritual side of me is interested in the psychedelics. So I really tried to make a retreat where we combine all wellness. They're really beautiful healing spaces. I love them. So yeah, people can find me in those places.
Yeah, so the retreats, how wonderful. And so actually that brings up one more question, which is around this integration of the
Mm-hmm.
anti-aging and regenerative medicine with
Mm-hmm.
psychedelic. Do you feel like is there a connection there as far as unlocking certain ways in the mind that can help us kind of slow down our biological clock in some way?
Oh, so they have done studies actually specifically on ayahuasca. Um, and ayahuasca does lengthen your telomeres, which is one of the signs of aging. So, and I don't know, unfortunately, so I apologize. I don't know the study, if it's, how many sessions or over what period of time, but I would imagine it's not just ayahuasca. I would imagine it's other plant medicines as well, probably because of like you're moving through trauma, or you're moving through whatever might be holding you back, which stress is one of, I mean, life stressors is a huge, it's not a marker, a contributor to
Well, the
aging. So if
source
you
of
can,
premature aging, right?
yeah, and so I would imagine it's something to do with that. And when you're decreasing the stressors that are wearing you down, like the chatter in the back of your mind, even if it's not in the forefront of your mind, that's going to lessen aging. But there's not a study on that specifically, but that's what makes sense to me. So these medicines do lengthen telomeres, and they do affect your epigenetics, which are parts of like your DNA that you can actually pass down to your kids. So, I mean, they're amazing medicines. And so, in terms of like regenerative medicine, I mean, stem cells impact aging, so we're using your own stem cells and putting them back into your body. That is going to slow the process of aging. Um, and kind of putting it all together again, like in my practice, I mean, I think you can't have one without the other, or you don't have, or to optimize, you really need both. And so we will have patients set intentions and do a whole process, I mean, it's a whole process, but intention setting, like if they're going to do kind of like, let's say, stem cells and psychedelics, of thinking about their pain, where does it come from, diving into that, but even really believing and thinking and seeing like those stem cells heal themselves. So then when we do the procedure and then take them on a journey, like that whole process is enhanced, right? When you're seeing yourself heal yourself. And sometimes it's ready and obvious and people can do it. You can't really control where your mind is going to go on these journeys, but spending time ahead of time, setting that intention, and then really, again, it's, believing in the power of healing yourself. I think it really makes it that much more powerful when you do kind of both together, not at the same exact time, but, over a week or so.
Yeah, how wonderful. And I know there's not a lot of people doing this work in this integrated way yet. So I'm very excited for what you do and what you offer. And we'll have
Yeah.
all the links below
Yes.
so people can connect with you and learn and heal. And thank you again, Dr. Quinn, for being
Yeah,
here. It's been such a pleasure.
it's been so nice. Thank you again for having me.
Yes, wonderful.